It's been 8 weeks, 3 days post-op. Um, and 2 days ago is when I seen the pelvic floor specialist for all my post-op appointments. And see, well, so far everything's still good, except for a few things that we've been working on. Was certain parts that were tight, because like before surgery, seeing the pelvic floor specialist because of the pelvic floor and everything, how it was tight and not coordinating properly. Well, since having my gender confirming surgery, a lot of the issues have been resolved. Pretty much almost 100% of the urinary issues I was having is resolved. It's about maybe one, like 5 to 1%, like 1 to 5%, kind of. I have a little, but I haven't been having like leakage or anything like that. Like it was before surgery, or fluid overload would make it worse before surgery. That hasn't been happening. It's just once in a while when my bladder is full and I get that signal that I have to go right then and there. And if I don't go right then and there, it's hard to hold it in. That's about most of the issue I have, which has only happened like 6 times since surgery. So, yeah. But the issue is my inner thighs are tight right next to the genitalia, the two sides where the leg connects. I can't remember what muscles those are called, but like on the side, right in the middle of it. This, where, yeah. The best way I can describe is here's like the legs, the genitalia would be right here. It's like the sides right here where it connects, the middle of the side right there, where those little muscles are. Those are tight. Like the one on the right side is more tender and tighter than the left side. And on my lower abdomen, on the left side, right? This side, yeah, the lower. That's where I've also been having an issue. And those are spots I had issue before surgery. I'm still having that issue now after my gender confirming surgery. So she ended up adding 2 more exercises I have to do to help. And also when dilating, as everything's still opening up to allow the dilator to insert or to be able to go in more. It's been stinging, and she explained on the right side there's a nerve, because she had to check internally, like, because before surgery how they checked everything internally compared to now, because this time they did vaginal when they checked all the muscles, like which ones I can feel, which ones are tender and whatnot, and all that fun stuff, because the issues I was having, it's the one on the right side where I was having the issue before. It's still the same. And she was explaining that there's a nerve that goes through there, because how it was kind of stinging when I was trying to insert the dilator when dilating. So she was wanting me to take the dilator and rotate the tip so it's towards that muscle to help press against it, to help desensitize it so that doesn't happen. Which it's been kind of uncomfortable because it goes from where the perineum is all the way up to the clitoris hood on the right side. It runs the whole entire length, and yeah. And as things are still healing, they're still wanting me to do the massaging the way I'm supposed to, but also help stretch things out so that it's not pulling on things. Because the other issue I'm having, I don't really like to talk about it as much, but I've mentioned it in my videos before. Spontaneous orgasms. Um, this last month, they've increased the most I've ever had since I've been tracking them every month, every day. And it's gotten to the point where it's starting to get to me. It's kind of overwhelming. They're not fun, it's not pleasurable. And yeah, so at my appointment, I mentioned them and things that came up. I just sent them a message of everything that came to mind that I've experienced that triggered it and whatnot. And they're thinking it's physical, like the nerves, and we have to treat it physical. So she was wanting that to be my last appointment, or if I feel I need another one, to have another appointment with physical therapy. So I decided to have another appointment to help address the issues with the orgasms, the spontaneous orgasms. So, yeah, they're brainstorming. They're trying to figure out on my situation what's causing it, what can be done. They're saying like prescriptions can change like the nerves, and surgery can change the nerves and where pressure is being put. So there's like stretches I have to do, specific ones to target certain spots to help stretch things out so it's not pulling against certain spots like my clitoris or the clitoris hood, so nothing's like pulling against that area, causing stimulation. Or use products like a lubricant that numbs, like those kind that's used for like either anal or to last longer with sexual activity. To put that kind on the clitoris to help so it's not, to desensitize it for a while to help prevent more orgasms from happening. And when dilating, they also want me, when I'm laying there, to angle my legs inward like that, like my knees. Pretty much angle it in like that when dilating. So, because it opens it up this way in the vaginal canal to help so it's not pushing against everything, causing that stinging as well. And there's a product she mentioned because when having like sexual activity or there's like penetrative sex with a toy or the real thing, it's called an onut, spelled OHNUT. It's basically like a little donut type thing where you can connect multiple together. So when having that penetrative sex, it's like a damper or a stop, so it doesn't go too. So when you're using a toy or the real thing, so it doesn't go too far in and hit the back of the vaginal canal and be uncomfortable. So that's what product that was recommended. And because my vaginal canal is like 4 inches, I can't do anything pretty much 4 inches or more, all the way inserted would be uncomfortable. So that product could be helpful for those who don't have a vaginal canal that's a really deep one. So yeah, and everything. But overall, how I just been feeling is I'm happy still, even though I'm having these issues that's been going on, that's getting to me. I'm still happy I've had the surgery and that the urinary issues have gotten almost 100% better. But it's the orgasms is what's getting to me the most, because I've been experiencing waking up and just having orgasms, just waking up, spontaneous orgasms. And it's not from like any clothing or anything being tied against the clitoris or anything like that, because what I've been wearing to bed is loose fitting, like a night shirt, and just my underwear and a pad because I'm still having drainage, which was weird because the drainage was getting less, then started having a little bit more drainage, but then it's less again. And yesterday morning, I noticed I had a little bit of bleeding, but then it stopped. So yeah. So yeah, so we're just trying to do the best we can with all this. The thing is, my next appointment probably would be my last one if I can self-manage everything at home. But just trying to figure out what's causing these spontaneous orgasms to happen. So yeah, other than that, I've noticed a couple of things. I've been actually exploring my body by looking in the mirror, just looking in the mirror and just looking at my body the way it is now, how it is. And I've been noticing I've had some changes. There's two noticeable changes. My breasts feel bigger and fuller. And at times seems like my bra are becoming too small, but not to where I can wear a cup size bigger yet, but still where it's kind of a little uncomfortable at times, but it is what it is. So they're fuller, which is a good thing because that helps with my dysphoria, obviously. And another thing is the shape of them. There's more shape to them, and I've been noticing I have more side tissue here towards the underarms. And the shape here comes in more on my chest. Like the breast shape goes in towards the middle part here, where the cleavage is more than it did before surgery. And the thing that's really good that's been happening, the other change, is my butt. Not necessarily how I've been trying to get that shape. It's the shape it's been before surgery, but my butt is a lot fuller and bigger everywhere. So, yeah. And I gained weight is the thing that's been helping as well with all that. Last I weighed 121 pounds. So I've gained a pound back. Another pound back. So I'm hoping I can get back to my normal weight of 122 so I can continue to get to my goal. I've been trying to for a long time of 130 pounds, but just have to keep working on that. So the healing of everything is still going. There's still times where I feel kind of like a burning sensation or a stinging or tingling. And yeah, other than that, the scars are starting to fade and look better. It's just the upper part on the sides of the vulva, the very top, where the thicker stitches, where there's more stitches put on that top upper part. Yeah, the uppermost part on the sides. That's still thick on the left side. The right side has gone down, and the left side's gone down, but not as much as I would like. So I'm just working on that. And the issue I was having with that nerve has healed. So I'm not having that stinging on the left side where that nerve was. Yeah. Other than that, everything seems healthy. Everything's healthy, healing. The only spots that's still not fully is obviously where the scar lines are. Part of the vaginal opening where it's been stinging on the right side, where that nerve goes through, I mentioned. And in between the labias, from the clitoris to the urethra, where it's placed on my body, right on the sides where the clitoris hood is, right? It's about a gap like that in between the clitoris and the urethra. It's on the sides of the clitoris hood, on the inner part, not the outer part of the clitoris hood, but the inner part in between everything. It's like right there. It's still not fully healed. And the swelling's still going down and everything's becoming flatter. But that's not fully healed yet. So that's part of the issue of the nerves as that's healing on the right side. Felt a little bit on the left side as well, but the right side is the part where I'm having that issue. And the clitoris hood where I had those two lumps is almost, one of them's almost 100% gone. It's so small, it's very hard to tell it's there. And this the upper part of the clitoris hood, but off to the side, on the left side, the lump is flattened out a lot more and it's decreased in size, but it's still there. So I'm just waiting for that to finish going down, which it's taken a while. So yeah. And not the last time I seen the pelvic floor specialist, but the time before that, she explained that with the drainage, because at first you use the menstrual pads for the drainage, then after you have no more bleeding and all that, then you switch to the urinary ones, because when you switch to water-based lubricant and you have drainage from that, if you have any, then urinary pads are meant for absorbing the liquid, so from the drainage. So yeah. So done that. And that's pretty much what doing. I've pretty much stopped using the medicated stuff for dilation, except last night because I had a little bit of bleeding, which the bleeding stopped. So yeah. So I'm on the water-based lubricant now. I'm still using the orange dilator, the biggest one in that set, which was advised there are 2 sizes bigger you can get. But when I checked it out, it's in the silicone dilators and not the harder plastic ones. So, yeah. It's like if she's talking about if when I get back to sexual activity normal as they want, if I have like a partner who's, they just mentioned like if you have a partner that's bigger than the orange dilator, then you can get a bigger size and dilate with that bigger one to accommodate for that. But I don't really plan on having an actual, even though because of my fluid sexuality, sometimes I want one. Doesn't mean I'm going to. So, yeah. So I was thinking like toys. So I'd have to like experiment and figure out what works and what doesn't. So, yeah, because they're wanting me to get back to that normal sexual, like, care, like activity. That's the normal amount, and not have things too desensitized, because they want me to still keep like sexually having those orgasms. They don't want them to stop completely, but they don't want them to be where it's like disrupting my normal day-to-day stuff. So just have to keep doing everything I need to resolve that issue. So that's pretty much what's happening with since my last update video. So it's, yeah, a lot I'm going through. And this is just my experience from having surgery, gender confirming surgery. I can't speak on anyone else because everyone's bodies react differently. And yeah, so if you're really curious or wondering or want to know more, please comment so I can answer or do a separate video to answer any questions, because I would love to do more videos on things that I may not have mentioned. That if you have any questions, especially if you're gonna have surgery, this like the male to female gender confirming surgery, and if there's anything I haven't mentioned that what I've been going through with the aftercare and the healing and whatnot. So please comment and ask questions so I can further help educate and help others out there to learn and help going through all this process, this wonderful, wonderful experience having surgery. That's huge, life changing. That's so worth it to me. How I feel, everything I've gone through with the surgery and healing and whatnot, it's all been worth it. To have no dysphoria, about down there to a point. Because, yes, I still have a little bit of dysphoria in some areas. In some, I don't. Like the genitalia wise, I don't. It's mostly how the orgasms are just getting to me. And other than that, just doing the best I can with it all. So please, please ask questions to help others with this whole process. Because in my experience with it all, that keeps coming to mind is it's worth it. Everything I went through, everything I've achieved to get surgery up to this point, for me, everything was worth it. And worth every moment, every bit of pain, dysphoria, discomfort, sadness, happiness. It's been worth it. Especially when you get these weird feelings and sensations as things are healing. Like how they say, the last thing that's coming to mind is those phantom feelings, like it's still there. Like they say, phantom penis, like you can still feel it when it's not there. Well, that pretty much kind of like it went away, but then there's like a moment or two where, because like the brain, like the connection and everything, sometimes when things are stimulated, kind of, they're like they both work together. So sometimes, kind of, because some thoughts do come to mind, like masturbation pre-surgery compared to now. Sometimes a thought may come to mind like before, so it kind of triggers like a feeling of it being there when it's not there anymore, if you know what I mean. So yeah, so once in a while, like a couple of times I noticed that's happened, but other than that, that phantom feeling is just like pretty much gone, except for those couple of times where that thought came to mind and kind of associated with that. So, and just, yeah, especially when sometimes we'll try not to get too much pressure against the clitoris, but sometimes when clothing, the pad and whatnot rubs against it, sometimes that feeling and sensation and the thoughts can trigger that feeling, like that phantom feeling. But yeah, just trying not to stimulate things non-sexually so it doesn't cause those orgasms helps. But since only having that phantom feeling twice since it went away a month ago, last month, yeah. So other than that, healing is doing the best I can. And I can't speak on certain types of clothing, outfits, and whatnot since surgery because I've just been wearing skirts because I'm trying not to have too much pressure against all that because this spontaneous orgasm issue. So, because I haven't experimented, well, I've tried one pair of pants on once and it fit really well. It's just I have to figure out what kind of underwear I could wear with it to make it work better because how low rise those pants are. But other than that, everything's healing. I'm happy with it. It looks even better since all that swelling's gone down. And it's just feeling normal. More so normal as time goes on. So that's pretty much what's happened since my last update video, surgery update video, till now. So yeah. So please, 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 please comment, rate, and subscribe. And until my next video, boo.